Yeah, so today I will explain you the difference between counseling psychology, clinical psychologist, and psychiatry. Now, the difference between the three is psychiatry is a medical MBBS degree where the doctor is allowed to give medication to the patient. So, let's say if a patient comes for depression, anxiety, schizophrenia, bipolar disorder, any sort of neurotic disorders, personality disorders, behavior, cognitive, psychotic, every category, the psychiatrist can give medication to the person. But there are many people who don't wish to take medicine, but they rather prefer therapies, or they take medication plus the therapies to work on their mind, because most of the mental health related issues are mind driven. So if you require therapies, then you can reach out to a counseling psychologist or a clinical psychologist, as both specialize in doing therapies to the patient. They empower a patient with mind management technique depending on the specialization they have taken. If I have to talk about my specialization, I take care of CBT, NLP, REBT, then Vedic psychology, graphology, art therapy, color therapy. All these are my specialization. Dream analysis. Somebody else, like a clinical psychologist, may have a certain therapies. There are many who are doing hypnotherapy, pranic healing also. Some of them use Reiki along with mind management techniques. So it depends from person to person or therapist to therapist, depending on the specialization they have. You can reach out to them, and with your comfort zone you can choose your counseling psychologist, you can choose your clinical psychologist. And if you decide to take medication and get yourself diagnosed thoroughly clinically, then you should go to a psychiatrist. So these are the core things which you should keep in mind while selecting whether you want to go to a psychiatrist, whether you want to go to a clinical psychologist, whether you want to go to a counseling psychologist. So I hope you understood. It helps. All the best.